Hello dear patients, today we are going to review the case of reddening and peeling of foreskin and scrotum. A man came to us, he has a constant sexual partner and he has reddening and peeling more of foreskin. It is also dry and it obstructs in a normal sex act. There is also an itch of scrotum skin. During observation we see that foreskin is inflamed. It is dry and this on its own may lead to phimosis. I'll remind you that phimosis is narrowing of foreskin. Skin diseases accompanied by dryness and inflammation may decrease the volume of foreskin, and during usual loads like sex, they may induce cracks and decrease in volume and thus facilitate the development of phimosis. During a long-term course, phimosis may develop into paraphimosis. You can watch a separate video on our channel about what is paraphimosis. Paraphimosis may even require surgical treatment, so of course these processes have to be eliminated. What needs to be done during such clinical picture? First of all, scraping for fungi is required here. Indeed, different mycoses of scrotum area often have an asymptomatic course. Therefore, both culture test and scraping for fungi need to be taken in this case. Secondly, considering reddening on foreskin and slight peeling on glans penis, it's necessary to take PCR analysis for candidosis, culture test for candidosis and culture test for bacteria. For sure, this has to be preceded by analysis for sexually transmitted infections, if there are any suspicions on them, and even without such suspicions. This man had negative analysis both for sexually transmitted infections and for candidosis, scraping for fungi and culture test for fungi. Later on, such men have to be checked for diabetes mellitus. At least glycated hemoglobin and glucose have to be checked. This, of course, is done on an empty stomach and to do analysis for allergy. You can watch a separate video on our channel about what it is. In this young man, analysis for diabetes mellitus were negative, but immunoglobulin E was positive and basophils were positive. Their level exceeds the normal one several times. So here it's feasible to set the diagnosis of dermatitis, allergic dermatitis, first of all, and secondly, consultation of allergologist is mandatory here, as dermatologist using his ointments cannot heal the changes in blood that are present. So a search of allergen is required and in some cases testing for food intolerance, etc. This is not what dermatovenerologists do. That's why the patient was consulted by allergologists in our clinic and corresponding treatment was prescribed to him. And apart from that, he was recommended calcium gluconate, sodium thiosulfate in injection form, antihistamine medications and external therapy. Some food allergens were found in him and they were excluded. Also, on the background of treatment, an improvement was observed. What can we mention here in the end? We can say that dermatologist using his ointments cannot always help the patient. In the majority of cases, a full-scale examination is required, as well as treatment of found causes. If this is not done for you, then this is quite bad, because this would lead to relapse of such diseases, and in our case this may lead to paraphimosis and other complications, considering the lesion of foreskin. If it is necessary to diagnose and treat any rashes in the area of sexual organs, you can consult venerologists and urologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.